Every few months in Uganda, you can expect to see another story on the news of a woman who was cut off her husband's penis. Maybe he annoyed her, maybe she caught him cheating. So someone is asking, is it possible to reattach this penis and someone regains their sexual function very well, and can this procedure be done in Uganda? So it is very possible to reattach a severed penis or any appendage at that. When I say appendage, I mean any body part that is projecting from the central torso. So an entire limb, a finger, a penis, an ear, etc. In fact, the very first such successful surgery was done in 1962, the same year Uganda gained independence. This was done in America, Massachusetts, where a 12-year-old boy's entire arm was reattached after it had been amputated in an accident. However, for such an operation to be successful, some conditions have to be met. The very first one, immediately after the amputation, the amputated body part needs to be preserved very well. So you should keep it in a sterile gauze to prevent bacteria invading it, and then you should keep it cool, but not frozen. When I say cool, I'm talking temperatures between 2 degrees Celsius to 6 degrees Celsius. Anything at 0 or below will cause ice crystals to grow within the cells, and it will destroy the body part. Then number 2, the surgery to reimplant the penis, what we call penile reimplantation, should be done ideally within 24 hours, not more than 24 hours after the accident occurred. To get optimum results, it should be done within 6 hours. This is because the more we wait, the more these cells suffer from lack of oxygen, and after 24 hours, there might be too much damage and the body part might have died off. Then thirdly, and actually most importantly, you need an army of surgeons who are proficient in what we call microsurgery and who have the relevant equipment to perform these surgeries. So whenever you're repairing any body part that has been severed, including the penis, first you have to reattach the blood vessels. You have the arteries that are bringing blood, then you have the veins that are taking away the used blood, you have the nerves that bring the sensation and take away the sensation. Then for the penis, you also have to reconstruct the urethra that is bringing urine, and also the spongy tissue that facilitates an erection. Now, these are very, very small body organs. Some of them are less than 1 millimeter in diameter. To be able to reattach them, you need something like a microscope, which can zoom in and you see like times 10 times 40. Also, you need very, very small equipment, like the surgical equipment. Not to forget, the surgeons who can perform this procedure are some of the most proficient and most experienced in the field. Usually, these are people who studied from abroad, where they had very good equipment and they had very good hands-on experience doing such procedures. So, in the case of Uganda, are we able to perform this procedure? Now, as of today, we haven't performed a single procedure to reimplant a penis that has been severed, even though we are having multiple cases. Now, this isn't due to lack of experience or technical know-how amongst our surgeons. In fact, most of the surgeons here studied from outside. I feel like it boils down to the facilities being